Some people live in survival mode for so long that it stops feeling like stress and it starts feeling more like who they are. Always pushing, always scanning, and always bracing for the next big thing. At a certain point, it doesn't even register as a pattern anymore. It simply feels like a new normal. But in many cases, that's not personality. It's a nervous system that has learned to stay in protection mode. I'm Dr. Kenny, IFM certified functional medicine practitioner, and I spend a lot of time helping people recognize patterns like this in the body. Start in the mind, manifest in the body. So in this video, let's take a clear look at what survival mode actually does to your function or to your physiology, and how to tell if your system has been stuck there longer than maybe you realized. A lot of people assume that survival mode has to look obvious, like panic or collapse, PTSD, and even burnout that everyone around you can see. But that's often not the case. Those experiences are 100% valid, but it is more of a spectrum as well. More often, it doesn't look like the black and white conditions that we have names for. It looks functional. You're showing up, you're capable, you're getting everything done at home and work, but your nervous system never fully settles. That's the big picture here. There's this constant undertone of tension and low-grade stress chemistry, urgency, and the internal effort running in the background that's often hidden. If this sounds familiar to you, it usually doesn't feel like a quote-unquote problem that I need to solve. It feels like just who you are and how you operate. And that's exactly why this pattern goes unnoticed for so long. And when we talk about chronic stress chemistry, this experience underlies almost every chronic condition that you can imagine, and that's in the research. Culturally, we label it as ambition or a busy season, or that's just how life works now. But one of the clearest signals here isn't whether or not you're simply functioning. It's how much it costs you to keep functioning. That's where the lens starts to shift in a big way. So what is this constant stress signal doing inside of the body? Survival mode is often framed as something purely emotional. That's usually how people experience it most explicitly. But in the body, it behaves like a coordinated physiological or functional response. When your system perceives ongoing pressure or instability, where your outputs may not match your restorative inputs, it starts reallocating your resources toward protection, rather than some of the finer things in life, like, I don't know, a level mood, or perhaps even sex chemistry, for instance. That shift involves the nervous system, but it also extends into your hormones, your immune system signaling, even energy production at the cellular level, and your capacity to recover and restore. Cortisol is one of the main chemical messengers involved. It helps from just being our stress hormone, and it regulates inflammation. It prepares your body essentially to respond to the demands placed on it. In the short term, this process is ultimately adaptive, and cortisol is incredibly beneficial. But cortisol doesn't stay contained to one system. We have receptors on literally every cell of our bodies for cortisol. Research on cortisol signaling shows that these signals influence multiple tissues throughout the body for this very reason. The same stress signal shapes how your body uses energy, how you recover, and also your body prioritizing immune and inflammatory signaling. Especially in the context of survival mode, this adaptation rarely shows up all at once. It tends to build gradually under the surface before it becomes obvious. It starts to show up in areas like your sleep being lighter or less restful, or your allergies may flare up more season to season. Perhaps your patient in that emotional resilience set point shortens, and maybe people write it off as you've just got a temper. What's going on in the background is you often need more effort in terms of your energy resources to get the same result and to perform at the same level. Individually, none of these oftentimes are significant enough to have you run to the doctor or overhaul your life. And that's part of the problem. Nothing stands out enough to question. You may take a medication or a supplement or something over the counter symptomatically, but together they start to point towards something changing in your overall resilience. This is where the concept of the cumulative body burden of stress becomes useful. The body is constantly tracking what it's been asked to handle. And that's why this is such a slow build in many of my patients. It's a slow drift over time until something big shifts in their health to get their attention. It could be a life transition, a experience of mold in a building or in your home, a drop in your reserves because of a post-viral circumstance. Basically, one or more stressors that push your system and its total capacity beyond its current limit. When it shifts this profoundly, it rarely feels connected to those smaller things that have added up over time. If you want to make this pattern of survival mode a bit more tangible, there are two main systems that I look at most frequently that reveal some of the earlier signs. The first is blood sugar control and regulation. Cortisol helps to mobilize fuel so that the body can respond to demand. Glucose is one of those fuel sources. That's obviously useful in short bursts when we need it, but in our chronic stress chemistry-filled world, that is not such an acute situation anymore. When that signal of leaching glucose into the bloodstream from the cortisol pathway happens more regularly, blood sugar regulation can become less stable. It's very easy to turn right to the diet, prediabetes, diabetes, insulin resistance. But it's often forgotten that cortisol plays a huge role in this process as well. It gets interpreted as, oh, you're eating too much sugar, which may also be true, but what you actually feel is irritability, urgency, energy crashes, and that wired and tired sensation, where you're pouring from that proverbial empty cup. Many times, this blood sugar piece is treated as a completely separate issue than the mental emotional piece that's also going on underneath the surface. The second big area is hormone signaling. Over time, chronic stress influences the reproductive hormone axis, the communication network that actually is involved in regulating your sex hormones. And this includes the brain, the adrenals, and the sex organs. Research looking at stress chemistry and fertility shows that ongoing activation of the stress response can suppress or disrupt signaling in a way that influences fertility. This helps to explain a pattern that many of my patients notice. Things often feel manageable for years. Many of my women may have symptoms of irregular menstruation, but it's written off as normal as well. This is all well and good until oftentimes a major transition point. This can be a major life event that puts extra strain on the stress response systems. It could also be perimenopause, menopause, andropause, or a period of deeper burnout. And that's when it feels everything shifts all at once. But that shift is usually a result of a system that has been adapting to the demands placed on it the whole time. This is where the pattern becomes easier to miss. Many people living in survival mode are not falling apart. Externally, they're the ones that others are relying on. This could be mothers. This could be business owners. This could be high performance executives. They're consistent, they're productive, high achieving even. Things keep moving along because of the energy expenditure that they are putting into their efforts. If anything, our culture tends to reinforce this, and it gets rewarded externally as well. Although thinking of many of my moms, they're the ones that deserve a little more reward in this particular area. Under the surface of that high performance and that give energy, something is shifting slowly underneath. Maybe longer recovery, exercise tends to impact you more, and there's more soreness or energy dips on the other side. Even low-grade symptoms like allergies or subtle inflammation show up more often. Nothing, again, looks severe, and many of my high-performing patients and mothers power through. But the margin in the systems is shrinking. That's an important distinction. Performance can stay high even while resilience is slowly and subtly declining. You can continue producing and showing up and meeting expectations and moving forward in life while your system is quietly spending more resources than it is replenishing. And that gap can last a long time before something becomes more obvious. There's a version of this conversation that also focuses on the impact of trauma on survival mode. And that's incredibly valid and an important thing to dive into for many people. But it's also not the only pathway into this pattern of survival mode. Sometimes the signals that create survival mode are reinforced through repetition, through family patterns, through pressure of society, or even overextending oneself. What's really happening there is the individual is often moving against their own internal cues, saying yes when you mean no, or pushing past those moments of fatigue and leaning on the expectations of you to show up at an event that you have no energy for. It looks like ignoring limits because something else feels either more urgent or expected of you. But realize those choices aren't neutral. They become signals because the body isn't just responding to what happened once. It's responding to what keeps happening in the systems. And when the pattern is more consistent, the systems adapt accordingly. If this pattern has been building for over time, it usually doesn't unwind through one single intervention. In our conventional paradigm, that expectation alone can create a lot of frustration. Again, there are cortisol receptors on every cell of our body, so no cell is spared from the effects of chronic low-grade cortisol that drives survival mode. Because most people are still looking for that panacea, that something that quickly resets the system. But when the body has adapted to a repeated signal for so long, it typically changes through repeated inputs as well, especially from multiple directions. There are many tools that can help. Different forms of therapy and counseling, nervous system work, breath work, boundaries, more aligned choices, even blood sugar regulation, and eating for more stability in the stress systems. For some people, major trauma is a part of the picture. For others, it may show up as a higher ACE score or adverse childhood experiences, meaning more cumulative early life adversity. If you've never taken it, it's a short 10-question questionnaire. And for many others, it's neither one of these in a clear way, but it's a long-standing pattern of pressure and that self-override. The common thread with survival mode isn't the exact cause that drives it. It's the pattern and the chemistry that the body has used to adapt to it, which means that the shift comes from consistently sending different signals, different inputs to this system. Maybe not perfectly or all at once, but things that can get incorporated and ingrained into the more authentic and real version of you. And guess what? Your output, your productivity, your connection to loved ones and to life, those are the things that are going to reap the benefits from this change. Once you start seeing survival mode through this lens, it raises an even deeper question for some. A lot of what we covered here points to a deeper layer in your physiology and in your chemistry, because one of the most common ways that this pattern shows up is not through obvious disease states, but through feeling exhausted when everything else looks normal on your normal labs. That disconnect is usually where people get stuck, and it just reinforces this cycle over and over again. And that's where cortisol rhythms, sleep timing, and blood sugar stability matter a lot more. The video on your screen here walks through that exact physiology in more detail and why this pattern can show up as fatigue and brain fog long before it shows up anywhere else. If this video has helped you reframe survival mode and recognize some of your own patterns more clearly, feel free to share what landed for you. I read all of them. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.